Assalamu alaikum students. Today our topic of discussion is blood coagulation. So first of all, procoagulants. More than 50 substances that cause or affect blood coagulation in the blood and in tissues that promote coagulation called procoagulants. And anticoagulants that inhibit coagulation are called anticoagulants. General mechanism. Clotting takes place in three essential steps. First is in response to rupture of the vessels or damage to the blood itself. A complex cascade of chemical reactions occurs in the blood involving blood coagulation factors. The net result is formation of a complex of activated substances called Prothrombin Activator. This is very important complex. While the Prothrombin Activator catalyzes conversion of prothrombin to thrombin. And this reaction, that is the conversion of prothrombin to thrombin in the presence of Prothrombin Activator, is the rate limiting step of clotting. The thrombin acts as an enzyme to convert fibrinogen into fibrin threads that enmesh platelets, blood cells, and plasma to form the clot. So these are the main three steps of clotting mechanism. So first of all, conversion of a prothrombin to thrombin. Prothrombin activator is formed as a result of rupture of a blood vessel or as a result of damage to special substances in the blood. Prothrombin activator in the presence of ionic calcium causes conversion of prothrombin to thrombin. Prothrombin and thrombin. Prothrombin is a plasma protein, alpha 2 globulin, molecular weight 68,700, normal plasma concentration 15 milligram per deciliter. It can split into smaller compounds like thrombin, having molecular weight 33,700. Vitamin K is required by the liver for normal activation of prothrombin. Conversion of fibrinogen to fibrin, formation of the clot. Thrombin is a protein enzyme, acts as a fibrinogen, acts on fibrinogen and results in the formation of fibrin, which ultimately forms fibrin fibers. Fibrinogen is a high molecular weight protein, molecular weight 340,000. Plasma concentration 100 to 700 milligram per deciliter, formed in liver. Blood clot. The clot is composed of a meshwork of fibrin fibers running in all directions and entrapping blood cells, platelets, and plasma. You can see here the clot having a fibrin meshwork, having threads of fibrin. Clot retraction. When a few minutes after a clot is formed, it begins to contract. Platelets are necessary for clot retraction. Therefore, failure of clot retraction is an indication that the number of platelets in the circulating blood might be low. So plasma having clotting factors, while serum is without clotting factors. So you can see here the difference between plasma and serum. Positive feedback of clot formation. Clot itself initiates a positive feedback to promote more clotting. Proteolytic action of thrombin allows it to act on many of other blood clotting factors in addition to fibrinogen. Thrombin has a direct proteolytic effect on prothrombin to make thrombin, and it acts on some of the blood clotting factors for formation of prothrombin activator. Initiation of coagulation, formation of prothrombin activator. Prothrombin activator is formed by two ways: by extrinsic pathway that begins with trauma to the vascular wall and surrounding tissue, and the other way is intrinsic pathway that begins in the blood itself. So we will discuss both of these pathways one by one in detail. So first of all, you can see here the conversion of a prothrombin to thrombin in the presence of prothrombin activator and calcium, and this thrombin then converts fibrinogen into fibrinogen monomer, and this fibrinogen monomer in presence of calcium converts into fibrin fibers, and these fibrin fibers in the presence of fibrin stabilizing factor results in formation of cross-linked fibrin fibers. So extrinsic pathway for initiating clotting. So first of all, there is tissue trauma. So there is a release of tissue factor which activates factor VII into VII activated, and this is VII factor activated and the tissue factor both results in the activation of 10 factor. So there is conversion of 10 into 10A. 10A means activated factor 10. This activator factor 10 activates prothrombin activator in the presence of factor V and calcium. So this prothrombin activator converts prothrombin into thrombin, and also there is a role of platelets and phospholipids in this rate limiting step, which is the conversion of prothrombin into thrombin in the presence of prothrombin activator, which is actually activated by factor 10 activated in the presence of factor V and calcium. So you can see here there is also the role of calcium in this rate limiting step, and this thrombin, this is very important, this thrombin acts on factor V, and this factor V activates prothrombin activator. So this is the feedback mechanism. So the more thrombin is produced, the more factor V is activated, and the more prothrombin activator is produced, and the more thrombin is produced, and ultimately there is more clotting. So this is the positive feedback mechanism, very important one. So release of tissue factor, factor III, traumatized tissue releases a complex of several factors called tissue factor or tissue thromboplastin. So tissue factor composition, phospholipids from tissue membranes, and lipoprotein complexes, proteolytic enzymes are also there. Activation of factor 10, role of factor VII and tissue factor. Tissue factor complexes with the blood coagulation, factor VII, and in the presence of calcium acts enzymatically on factor 10 to form activated factor 10, that is 10A. Effect of 10A to form a prothrombin activator, role of factor V is also there. The activated factor 10 combines with the tissue factor or with the phospholipids released from platelets as well as with factor V to form the complex called prothrombin activator. In the presence of calcium, this splits prothrombin to form thrombin, and the clotting process proceeds. The positive feedback effect of thrombin acting through factor V accelerates the entire process once it's begun. So this is all about which we have discussed in this diagram of extrinsic pathway. Now there is intrinsic pathway for initiating clotting. So first of all, there is blood trauma or contact with collagen. Then there is activation of factor XII, and the activated factor XII in the presence of high molecular weight kininogen and prekallikrein converts factor 11 into 11A, and this 11A in the presence of calcium converts 9 into 9A, and also there is the role of factor VIII. Factor VIII is activated into factor VIIIa, and the activated factor IX and VIIIa and calcium mediates the activation of factor X. And as you know, this factor X with the platelets and phospholipids and calcium, and in the presence of factor V, activates prothrombin activator. So factor X, platelet and phospholipids, and there is a factor V, and there is calcium. So these all results in the formation of the conversion of prothrombin to thrombin in the presence of prothrombin activator, which is activated by calcium and factor V and platelet and phospholipids and factor X. Factor X. And calcium is also required for the conversion of prothrombin into thrombin. So you have to memorize these two pathways. These are very important. You have to draw on your rough copies. You must draw them, so you should memorize them. These both pathways are very important. The second mechanism for formation of prothrombin activator and for initiating clotting begins with trauma to the blood, exposure of blood to collagen from a traumatized blood vessel wall. The process continues through a series of cascading reactions. Blood trauma causes activation of factor XII, release of platelet phospholipids. When factor XII is coming into contact with the collagen into a proteolytic enzyme called activated factor XII, simultaneously the blood trauma damages the platelets because of adherence to either collagen, and this releases platelet phospholipids that contain the lipoprotein called platelet factor III, which also plays a role in subsequent clotting reactions. Activation of factor XI. The activated factor XII acts enzymatically on factor XI to activate it. This reaction also requires high molecular weight kininogen and is accelerated by pre-calligrate. You see all these points in the path here. Activation of a factor IX by activated factor XI, and then activation of factor X, the role of factor VIII, the activated factor IX, activated factor VIII, calcium, the platelet phospholipid, factor III from the traumatized platelets results in activation of factor X. And you know this factor X then activates prothrombin activator and results in conversion of prothrombin to thrombin, and that this thrombin then results in the activation of fibrinogen into fibrin monomers, and then the formation of fibrin threads in the presence of fibrin stabilizing factor. So then there is a hemophilia. Factor VIII is the factor that is missing in a person who has a classic hemophilia, for which reason it is called antihemophilic factor. So there is also a von Willebrand disease is also there. So this von Willebrand disease, actually von Willebrand factor is the factor required for the activation of factor VIII. So if a von Willebrand factor is not present, then factor VIII does not work. So in hemophilia there is the problem with factor VIII, but in von Willebrand factor there is a problem, or there is the absence of von Willebrand factor, which is required for the activation of factor VIII. So the problem remains the same, but the cause is different. So I have discussed with you von Willebrand factor versus hemophilia. So there is a thrombocytopenia, von Willebrand disease versus hemophilia. So there is a thrombocytopenia. Platelets are the clotting factor that is lacking in the bleeding disease called thrombocytopenia. So again, you can see the intrinsic pathway. And you can see here the action of activated factor 10 to form a prothrombin activator, role of factor 5. This step in the intrinsic pathway is the same as the last step in the extrinsic pathway. So activated factor 10 combines with factor 5 and platelets or tissue phospholipids to form the complex called prothrombin activator. The prothrombin activator initiates the cleavage of prothrombin to form thrombin, final clotting process. So it is the same as that in the extrinsic pathway. So you can see here again prothrombin to thrombin in the presence of prothrombin activator and calcium, and this thrombin then allows the conversion of fibrinogen into fibrinogen monomer in the presence of calcium, forms fibrin fibers, and these fibrin fibers results in the formation of cross-linked fibrin fibers in the presence of fibrin stabilizing factor. So role of calcium ions in the intrinsic and extrinsic pathways. Except for the first two steps in the intrinsic pathway, calcium ions are required for promotion or acceleration of all the blood clotting reactions. Therefore, in the absence of calcium, blood clotting by either pathway does not occur. So it is very important point, because sometime a question is asked, write down the steps of intrinsic and extrinsic pathways involving calcium. So you can just skip first two steps of intrinsic pathway and all other path steps, and there is the involvement of calcium. Interaction between the extrinsic and intrinsic pathway. Summary of blood clotting initiation. After blood vessels rupture, clotting occurs by both pathways simultaneously. Tissue factor initiates the extrinsic pathway, whereas contact of factor XI and platelets with the collagen in the vascular wall initiates the intrinsic pathway. An especially important difference between the extrinsic and intrinsic pathway is that the extrinsic pathway can be explosive. Once initiated, its speed of completion to the final clot is limited only by the amount of tissue factor released from the traumatized tissue and by the quantity of factor 7, 10, and 5 in the blood. With the severe tissue trauma, clotting can occur in as little as 15 seconds. The intrinsic pathway is much slower to proceed, usually requiring 1 to 6 minutes to cause clotting. Prevention of blood clotting in the normal vascular system. Intravascular anticoagulants. So why normally blood does not clot in our blood column, in the blood vessels? Endothelial surface, the smoothness of the endothelial cell surface, which prevents contact activation of the intrinsic clotting system. This is the first reason why blood does not clot in our blood vessels normally, because of the smoothness of endothelial cell surface. Other is the layer of glycocalus on the endothelium, which repels clotting factors and platelets, thereby preventing activation of clotting. So other factor is the layer of glycocalus on the endothelium, which repels clotting factor and platelets. So there is no coagulation or clotting. A protein bound with the endothelial membrane, thrombomodulin, which binds thrombin. Not only does this the binding of thrombin with the thrombomodulin slows the clotting process by removing thrombin, but the thrombomodulin-thrombin complex also activates the plasma protein, that is protein C, that acts as an anticoagulant by inactivating activated factor V and VIII. You can see all this in this diagram. When the thrombomodulin binds with thrombin, the thrombin cannot activate the fibrin, so the process of clot becomes slow. And on the other hand, this thrombin results in the activation of protein C and protein S, which results in the inactivation of factor V and VIII, and also results in the inactivates inhibitor of tissue plasminogen activator. So when it inactivates inhibitor of tissue plasminogen activator, there is activation of tissue plasminogen activator, and this activation of tissue plasminogen activator results in the conversion of plasminogen into plasmin, and the plasmin ultimately results in lysis of fibrin. So there the This is the process of clot lysis. So the formation of a complex between thrombin and thrombomodulin results in the slowdown of clot process, and on the other hand there is clot lysis. So this is the mechanism of clot lysis. When the endothelial wall is damaged, its smoothness and its glycocalyx thrombomodulin layer are lost, which activates both factor XII and the platelets, the setting of the intrinsic pathway of clotting. If factor XII and platelets come in contact with the subendothelial collagen, the activation is even more powerful. Antithrombin action of fibrin and antithrombin 3, among the most important anticoagulants in the blood, are those that remove thrombin from the blood. The most powerful of these are the fibrin fibers that are formed during the process of clotting, and an alpha globulin called antithrombin 3 or antithrombin heparin cofactor. The difference between extrinsic and intrinsic pathway. The extrinsic pathway is activated by external trauma that cause blood to escape from the vascular system. This pathway is quicker than the intrinsic pathway. It involves factor VII. While the intrinsic pathway is activated by trauma inside the vascular system and is activated by platelets, exposed endothelium, chemicals, or collagen. This pathway is slower than the extrinsic pathway, but more important, it involves factor 12, 11, 9, and 8. So this is all about the clotting mechanisms, extrinsic and intrinsic pathways. So if you have any query regarding the clotting mechanism, you can consult me. Thank you. You can contact me. Thank you.